Welcome, everyone. My name is Elena Kidd, and I'm a program director with the University of Alabama at Birmingham School of Public Health's Office of Public Health Practice. I'm excited to welcome you to today's webinar, Assessing Adherence to Infection Control Procedures with Fluorescent Markers, featuring Wade Menefee and Shoshana Anderson from the University of Alabama at Birmingham School of Public Health. This webinar is made possible by the Alabama Regional Center for Infection Prevention and Control Training and Technical Assistance, or ARC-IPC. The ARC-IPC was established to meet the consultation and support service needs surrounding infection prevention and control throughout the state of Alabama. This center is a collaborative effort of the Alabama Department of Public Health's Infectious Disease and Outbreaks Division, the University of Alabama at Birmingham. The ARC-IPC provides training and technical assistance to infection prevention and control and public health professionals in the areas needed to detect, respond to, control, and prevent infectious disease outbreaks. You can learn more about the center and view and listen to past webinars, podcasts, sign up for our newsletter, request training and technical assistance, and view infection prevention and control resources at ARC-IPC at uab.edu or uab.edu/ARC-IPC. We'd like to thank our co-sponsors for today's webinar, the Deep South Center for Occupational Health and Safety, and the UAB Alabama Nursing Home and Long-Term Care Facility Strike Team. And you can learn more about their programs and the center as a whole at their website listed on the screen. We'd also like to let you know about our next webinar, Understanding Multi-Drug Resistant Organisms, featuring Kate Draper, who is a fellow with the Infectious Disease and Outbreaks Division at the Alabama Department of Public Health. Please join us on February 7th, 2024, and their URL and a QR code is on the screen. Continuing education credits have been approved for nurses by the Deep South Center for Occupational Health and Safety for this program. In order to receive credit for this training, you must register for the training, watch the entire program, complete the evaluation following the program, and upon completing the evaluation, you'll be redirected to the Alabama Nursing CEU request form, which you will also need to complete. CEUs will be awarded by the Deep South Center for Occupational Health and Safety. You do not have to submit directly to the Alabama Board of Nursing. If you experience any issues, please email arcipc@uab.edu. And finally, it's my pleasure to introduce our speakers. Wade Menefee received his MSN from Walden University in 2023. He has been a licensed nursing home administrator since 2017. He has a concentration in infection prevention and long-term care settings. His previous backgrounds include staff development coordinator, clinical IT nursing, human resources, nursing leadership, regulatory compliance, and nursing home administration. Shoshana Anderson received her BSN from the University of Alabama in Huntsville in 2004. She received her certification in infection prevention and control through the Certification Board of Infection Control and Epidemiology in 2018. She has a concentration in infection prevention and long-term care settings. Her previous background includes preventative endoscopy practices, surgical and patient nursing, high-level disinfection and sterilization, and emerging infectious diseases. Prior to becoming an infection preventionist, she has an extensive background in the operating room for 10 years and has worked as a circulatory nurse in an operating room leadership in which she has gleaned a wealth of knowledge and hands-on practice. She is committed to sharing the why behind the practices of infection prevention. So without further ado, it is my pleasure to turn things over to Wade and Shoshana.
So we'll go ahead and get started with our objectives today. Our objectives are going to be to recognize risk factors for healthcare-associated infections, identify the role of assessing training, audits, and competency in preventing and controlling healthcare-associated infections, describe strategies for assessing the adherence to infection control procedures during hand hygiene, PPE use, and environmental hygiene during training and auditing, discuss the quality assurance, quality improvement process while providing feedback. When we look at germs, the big thing that we want to get across to everyone is germs are everywhere. People anywhere can carry germs and spread these germs. They enter a person's body and cause them to feel sick, and then they start showing signs of infections. According to the CDC, the Centers for Disease Control, for Disease and Control, healthcare-associated infections, it's an estimated that on any given day, 1 in 31 hospital patients and 1 in 43 nursing home residents has a healthcare associated infection while receiving care in a medical facility. So therefore, reducing HAIs is critical to improving patient safety and controlling healthcare costs. So we have the infection prevention playbook, but the question remains, why are infections continuing to occur within these healthcare settings?
So the basics in infection prevention and control. In healthcare settings, and we're just going to review the chain of infection transmission. In healthcare settings, the transmission or spread of an infection is described as a chain or an active infectious cycle. This is the playbook that Wade referred to, and we know exactly how infections are going to occur every time that they occur. Always begins with the infectious agent, then the reservoir, the place that it lives, the portal of exit, mode of transmission, portal of entry, and I like to call it the free, all expense paid pass to go to a new destination. And then you have your susceptible host, and depending on the population, again, some risks are higher than others. The droplets or infections could be able to spread through either airborne, droplet, direct contact, or even indirect contact through inanimate objects, or also known as fomites. The fomites are inanimate objects that are most likely to transfer pathogens deposited by the infected host into a susceptible host. So think of it as door handles, faucet handles, bedside tables, the different objects that we could spread, touch, or then pick it up from touching that object that someone already touched. Some examples of diseases caused by fomite transmission are the common cold, influenza, meningitis, and even COVID-19. So in a healthcare setting, the surfaces are really divided into two different areas. And we use this picture just to highlight a lot of the common places, the common areas that people are touching. And so surfaces with minimal hand contact, such as the floors, ceilings, or window sills, those are what we are calling the minimal contact surfaces. However, the surfaces with frequent or high touch hand contact are known as the high touch surfaces. And when we come into facilities or talk with people, when we ask these questions, sometimes they tell us it's the things up high. But again, we're trying to make sure that everybody has the understanding and the knowledge that we're talking about surfaces that are frequently touched. I know our audience is varied today because we're all healthcare facilities. So many of these items that we have listed here, you may find within your facilities. The biggest takeaway is that the room potentially could be touched by that resident or patient. So any of the surfaces within that room could potentially be either contaminated or, again, be a part of that fomite transmission. So why is this important to us today? Because these germs can persist in the environment for long periods of time. And so the germs or pathogens of healthcare concerns, such as C. difficile, Escherichia coli, Enterococcus species, hepatitis B virus, the norovirus, and Staph aureus could survive for very long periods of time if proper cleaning and disinfection are not performed. So susceptible patients, residents, they could become infected or even colonize with these pathogens if they have direct or indirect contact with the contaminated surfaces or equipment. The germs, again, could persist in the environment for very long periods of time. And I just want to highlight a few things. So specifically with hepatitis, if the glucometers are not cleaned appropriately between use, hepatitis could live on the surface for greater than a week. So it behooves us to ensure that we have processes in place that would help to prevent the spread of infections. We know for C. difficile, it could last up to 5 months in the environment. And multiple persons could then be, again, infected or even colonized with this disease process. Enterococcus species, which is normally found in stool, could last between 5 days to 4 months. And then Staph aureus, which normally grows on skin, could last from 7 days all the way up to 7 months. So again, we want to always make for sure that the processes we have in place, we have the playbook, we know how to prevent infections, but we have to continue to ask ourselves, how do they persist? And we have to think about, it could be in the environment, on the hands of healthcare providers. That was the common way that it's thought to be spread. And so at all costs, we have to work to prevent that. Okay, so the role of infection prevention and control, it's critical to healthcare settings because we have to make sure that we are disrupting or ending that cycle so that we can stop the spread of the pathogens within the environment. Through this, although it lines up, if we were to wear personal protective equipment, it would keep the germs from leaving where it lives. If we were to adequately clean the surfaces, again, it will prevent it from being transmitted. If we performed hand hygiene, it wouldn't be that mode of transmission. And then again, by making sure we have the right persons on the right isolation precautions, it helps us to prevent those spread of germs. So we can also do that through standard precautions. And with that, we have several processes in place to help us with that. And we use standard precautions for every single person, whether we know them, whether we have a relationship with them, whether it's our favorite patient or not, whether they look sick or infectious or not. We have to always apply these standards no matter what. Anytime we're going to come in contact with blood, body fluid, or infectious diseases. So we have a lot of processes in place, and we have to make for sure that we are utilizing them regardless of if they are suspected or confirmed for isolation. Everybody will use it for everyone, every single time. And you could see on this list, there are common themes throughout, whether you're long-term care facilities or acute care hospital settings. Hand hygiene always still is number one, effective, very cost-effective as well. Resident placement, putting the residents in the right location, wearing our personal protective equipment correctly, performing our environmental cleaning and disinfection in between the use of patients or residents, making sure we're managing blood and body fluids, exposures, having the right waste properly for the right containers or receptacles in place, using respiratory etiquette. Again, all of these things are very basic, but if they are not used and managed correctly, then we could potentially be spreading germs and infections. All right, so the goal is to improve infection prevention practices. So there are core infection prevention and control practices that the CDC supports. And to save us on time, we're going to just highlight the two. But to go over it, it's leadership support, the education and training of healthcare personnel on infection prevention and control, the patient and family and caregiver education, performance of monitoring and feedback, and then making sure we follow the standard precautions we just talked about, utilizing standard-based precautions, temporary invasive medical devices for clinical management, and then occupational health. Okay, so training. In order for staff to know how to do a process, they have to be trained. So we normally provide training upon hire, but then we also need to make for sure that it's occurring annually. They have to make sure that training occurs every time there are new products in place, anytime there's a new policy or procedure that's developed, and in response to deviations from recommended practices. So when you're out doing rounds, performing isolation rounding or your regular infection prevention rounding, it's really important to also provide that feedback or just-in-time training response so that staff will know what to do in the times that they are having deviations. We also want to make sure that it's a verified competency following each training, which means a return demonstration. You're visibly watching them perform whatever the process is. Hands-on training and direct observation are practices that are particularly important when you want to assess competency for environmental cleaning specifically. Also excellent for hand hygiene as well. All right, maintain documentation that your education and competency were assessed and performed. Okay, so the types that you want to include in your training content. Definitely hand hygiene. It's whether you're washing it with soap and water or when you're using alcohol-based hand rub. Many people, when you stop and you ask, hey, can you show me how you wash your hands? Everybody will say, yes, I know what to do. But when you actually take the time to watch this procedure happen, you'll notice several deviations in practices. And so again, in order for us to make sure that they have consistent practices, that what is written in the policies are actually happening, we want to make for sure that we are watching that return demonstration. Next, cleaning and disinfection of environmental surfaces. Want to make for sure that all the concepts that are written in the policies, that they are following manufacturer's instructions for use, that it's all being followed. The use of personal protective equipment. This process right here is a place where we see a lot of deviation. Everybody seems to have their own particular way of putting on PPE. However, it's that taking it off could actually be the highest chance where you could get infected or contaminated when you're removing it. So we really want to adopt standardized ways, standardized methods that everyone is using the same exact methodology so that we can prevent the spread of infection. And then last but not least, point of care blood testing. Again, as we shared before with the glucometer, it's critical, and we want to make for sure that we are reducing the chance of transmission. So the fluorescent marker. So a way to have an enhanced option for your visual observations is to use a fluorescent marker. And we're going to call it FM because it was really long in writing it out. Okay, so to assess adherence to infection prevention and control procedures. So I have listed here multiple different brands. We're not here to promote one over another, but the point of it is that the fluorescent marker contains tiny particles that are activated by the UV light, and it reveals themselves as the glowing spots whenever it is put upon a surface. So depending on which product you're using would depend on what color it's going to glow. But the point of it is that you will be able to see it once you reflect the ultraviolet light upon it. Okay, this fluorescent marker could be purchased whether it's a gel, a liquid, or a powder. There's also some of the liquid forms that are oil-based, so please make sure whichever version you're going to use, consider the surfaces and what you're going to be using it upon. Okay, so in this approach, what it's done, that fluorescent marker is considered a pretend germ or a contaminant. Okay, and so when you place it on intact hard surfaces, they're marked with that fluorescent marker, and then it appears transparent under normal lighting. That's why this is one of those beneficial areas, because staff would not know if you've already marked areas or if you've already touched surfaces, so that, again, they're not doing it based upon seeing the germs. When we put up the slide earlier, we shared that germs are our invisible enemy. And so we want to always at all times make sure that we have standardized processes and procedures in place to help us so that whether you can see the germ or not, you're always adequately cleaning, sanitizing, or disinfecting appropriately, okay? So after the cleaning, sanitizing, or disinfection has taken place, you want to use that ultraviolet light to detect if any of the fluorescent marker is still present. If the fluorescent marker is visible, it objectively indicates that the surface was not adequately cleaned. Now, I do want to point out, if there are any cracks or non-intact places, or if you're using porous surfaces, then that fluorescent marker will still continue to be there. So you want to make sure that it's on an intact, hard surface, okay? This method does not identify any deviations in preparation of cleaning or disinfection products, or even how those products are applied, okay? So all we're inferring is that we still see the marker, and, adequate cleaning could help to remove it. Okay, so there are some advantages and disadvantages of using the fluorescent marker. So the advantages, it's quick. It provides immediate feedback on the performance. You have minimal training required to perform it. It's objective, so you could measure it. The benchmarking is possible, and it's relatively inexpensive. Some of the disadvantages are that it does not assess or correlate to bioburden. So you cannot use it to say the amount of germs or contaminants that's still left over, because it's not tracing or identifying that. It could be labor intensive, as the surfaces have to be marked prior to the cleaning and then checked after the cleaning has been completed. There may be some difficulties documented in terms of removal of the marker from porous, like we referred to earlier, or rough surfaces. And also, if hands are dry and cracked or chapped or with sores, then that will show up as well, okay? And sometimes that fluorescent marker wouldn't be removed immediately from those surfaces. Right? It could be time intensive. And you also, when you're using this, you have to vary the frequency and the types of objects that you're putting it on, so that staff won't just always clean the doorknob or the bed rail or the telephone. It really does need to be changed out so that you can have a really overall thorough observation. Okay, so some examples of how to use the fluorescent marker. So it would be ideal in hand hygiene training, and many of you may already utilize this upon orientation when new people are coming into the facility. Just like I shared before, it's something about seeing the fluorescent marker on your hand that just really brings about an awareness, like, wow, this is pretend germs. And I always have to say, these are pretend germs. It is just, lotion or powder or whichever object that you're using, because some people really see it and they, sometimes get a lot of anxiety behind it. So we continue to say this is just pretend germs. It's just to simulate that this is what's to happen. So you would place a small amount of the fluorescent marker on a staff member's hands, and we tell them to rub it on all surfaces. And you can use the UV light to review to see, did they put it on all surfaces evenly? Okay, so after they are to wash their hands, and we ask them to wash it per their hand washing policy. Of course, if you know or staff knows that they are going to see their hands be reviewed, they usually take longer than what's normally recommended, but they take a long time and they really scrub, really trying to make for sure that they have perfect hands. And so after the hands are washed and dried, then we're going to pass that UV light. You may want to consider the type of room that you're in. Hopefully it's one that you can control the lights or turn them down so that you can see what that UV light looks like after. Just one of the things to consider. All right, you're going to assess on their hands for any residual fluorescent marker left on the surface of their hands, including the nail beds and knuckles. You want to use those findings as a teachable moment for the trainee to improve their hand washing technique. So the complete removal of the fluorescent marker, it's more difficult if the skin is dry, chapped, cracked, or have any types of sores or calluses in them, okay? All it's doing is just to illustrate that if there are any bacteria or germs on the skin, it would also be hard to remove that from those areas as well. Okay, so this picture is just showing us what it would look like with fluorescent marker on the hands. Okay, so We would use this again as a teachable moment. Some other applications could be using it during orientation, using it during your annual infection prevention and control training, using it in response to any remediation or when you're having to review based on any deviations that you've seen in practice, okay? So again, objective, you can see it, it's no judgment, and we shouldn't use it to be punitive or as a I gotcha. Okay, so this is really just a teachable moment. You can use this training to highlight your policies, your procedures, and it would also be a great time to review what does the actual policy and procedure say. A lot of times we've caught a few things that needed to be adjusted just from doing the reviews. You have to also highlight the importance or the sequence of steps when you're performing hand hygiene, as well as all the surfaces to include. This is a great time to highlight the length of time and performing the correct hand hygiene method. Excuse me. You also want to make for sure that you are highlighting the importance of not contaminating hands during this process. And then you're looking on the hands for any places of improvement. And normally the fingertips and sometimes between the fingers, those are the areas, and the wrist are places that most people forget and miss. So this is just an example of the fluorescent marker of the areas that are missed. And you can see all the areas that are kind of glowing at you. The lighter colors, that tells you that there's some residual fluorescent marker. Okay, you can use this for personal protective equipment training exercise. I like this because it helps us to see that if you don't wear it correctly and if you take it off incorrectly, you could potentially be contaminated, so to speak. So they would don their personal protective equipment. You could either use gown and gloves or just gloves alone. You can place a small amount of the fluorescent marker on the gloved hands and then have the trainee to touch different areas on the front of the gown or the sleeves. Excuse me. You're going to doff the personal protective equipment or take it off. And then you're going to use the ultraviolet light to assess if there are any instances where the fluorescent marker was transferred onto the trainee. Okay, if fluorescent marker is seen on the trainee, you're going to use this opportunity as a teachable moment to shore up any educational gaps. So porous and non-intact environmental surfaces could show residue of fluorescent marker as these areas are unable to adequately be disinfected. So this is the picture of the fluorescent marker being applied to the front of the gown and gloves, and you can see the areas where it's glowing under UV light. And then you could see an example of what the fluorescent marker may look like because they touched a place that had the fluorescent marker on it, okay? So you're going to use this as a teachable moment to highlight, again, policies and procedures, the importance of the sequence of steps to use when putting on and taking off personal protective equipment. You're going to highlight the importance of not contaminating hands during this process or properly removing the gloves. You're going to share any areas that transfer is found. You're going to highlight the proper way to dispose of the personal protective equipment and the importance of performing hand hygiene post-glove removal. Okay. Another way that the fluorescent marker could be used is for surface and disinfection training. So this is just an example of a high-touch surface areas, okay, the doorknob and the telephone. You're going to lightly place a small amount of the fluorescent marker on the designated surface area. For your surfaces, you could use either the the fluorescent marker gel or the lotion or the powder. I found that the powder works really well as well. So you would make sure that you place it prior to them knowing that you're going to clean it, and it actually dries to like a translucent, so they can't see it at all, transparent image. Okay, and so you're going to clean and disinfect the surface. And they're going to observe their normal infection control policies. After cleaning and disinfection has been completed, you're going to pass that UV light over the surface where it was applied. That intact surface with residual fluorescent marker is going to glow on the areas that were not washed thoroughly. When you're checking the room for areas for cleanliness, the UV light could also be used for the detection of even urine without using the fluorescent marker. So this would be perfect in the bathroom space if you're looking to see how well it is cleaned, okay? So just again, a reminder for any porous or non-intact surfaces, it may show that residue of the marker because that area can't be removed. So just be careful about what surfaces you're using it on. With this, you want to highlight the facility policies and procedures. You want to highlight the importance of following the manufacturer's instructions for use. You want to highlight the importance of using personal protective equipment, the importance of the sequence of cleaning and disinfection, whether it's clean to dirty, top to bottom, clockwise or counterclockwise, the observance of wet contact time, the use of a timer, any residual areas that were found, the proper disposal of personal protective equipment, and the importance of performing hand hygiene post-glove removal, okay? And this is just an example of that fluorescent marker being seen under a UV light after cleaning.
So when looking at, Shoshana's done a great job of explaining to us about why infection prevention is important, how we can assess staff members' adherence to infection control policies with using the fluorescent markers, and why this is beneficial. So now that we've done all this, and we've got this, we've trained our staff, we've utilized the fluorescent markers to see how they're actually performing. Then we need to look at our auditing and quality improvement. Now, again, I do know we have a different audience, so auditing and quality improvement is going to look different across healthcare settings, but the purpose of it still remains the same. So when we're looking at our quality assurance and performance improvement, it's a data-driven, proactive approach to improving the quality of life care and services, not only in nursing homes, but in also all healthcare facilities. So when looking at those different terms, quality assurance is the process of meeting quality standards and assuring that care reaches an acceptable level. In a nursing home instance, it's typically sets QA thresholds to comply with regulations. Same thing within a hospital setting. They may also create standards that go beyond regulations. Again, QA is a reactive retrospect effort to examine why a facility failed to meet certain standards. QA activities do improve quality, but efforts frequently end once the standard is met. The performance improvement portion of this, also called quality improvement, or you may hear it referred to as QI, is a proactive and it's a continuous study of the processes with the intent to prevent or decrease the likelihood of problems. This happens by identifying areas of opportunity and testing new approaches to fix underlying causes and persistent or systematic problems. Performance in healthcare facilities aims to improve processes involved in the healthcare delivery, as well as patient and resident quality of life. And performance improvement can make good quality even better quality, which is the goal of what we're trying to do. So looking at this as a whole, what is quality? CMS has identified 5 strategic elements that are the basic building blocks of an effective quality assurance and performance improvement project. And what CMS has identified is that quality assurance and performance improvement goals and scope, guidelines for governance and leadership, feedback, data systems and monitoring, which is a great tool for this fluorescent markers to be utilized with, performance improvement projects. Where is an area that as a healthcare facility that we have noticed that we are not as top notch as we would like to be, and how can we improve on that? Let's create us a project to identify how we can improve on that. And then systematic analysis and systemic action. Thank you. And again, how are we going to do this? Just like Shoshana said, we're going to observe staff practices. We want to make sure that we're rounding. We're making unannounced visual inspections. and are a long-standing technique that helps to identify problems before they escalate into serious infection threats. Yeah, I think we typically, as infection preventionists, can sometimes get into the habit of, we've got to make sure that we're getting our staff observations in. We've got it marked on our calendar because we're all so busy that we're going to go on the first Monday of every month, and that's when we're going to do our observations. And then staff learn that. And they're going to be aimed to do better on those certain days. So we want to make those unannounced visual inspections. Observe staff practices with the assistance of a checklist. I know I operate better if I have a checklist and I'm going down my checklist and I'm making sure that every staff member is meeting this objective. It's just a way to keep that observation on point and going through and making sure we're meeting all that. Staff may modify their typical practices if they are aware that they're being observed. So therefore, you want to make those, a lot of times we refer to them as secret shopper. We may, get us a member of our team and, hey, can you go observe this floor while they're doing their hand hygiene and just see, follow my checklist and see how things are going. But again, that kind of goes into that pattern. If a staff member knows that on the first Monday, that we're going to come around and watch them do their hand hygiene, that it's, on the first Monday, they're going to be on their game about doing their hand hygiene. So just some things to remember about, observing staff practices. Performance monitoring. So the staff are performing, how are we making sure that what they're performing is the best practice? So performance monitoring and feedback ensure adherence to those facility policies and procedures. The frequency and the locations of the audit should be informed by your annual IPC risk assessment. So we want to make sure that, facilities are doing this annual assessment. The more frequent monitoring may be performed on higher acuity units or the rooms of residents on transmission-based precautions, because we know those are the areas that can generate, a lot of serious infections. Results of performance monitoring should be documented and shared to reinforce adherence to the recommended practices. We don't want to just document what we saw and then, put that in a file. We've met our checklist for the month and those are filed away. We're not going to do anything else with those. Self-assessment checklists and sign-off sheets can be helpful reminders, but these alone are not sufficient. Auditing. So methods for auditing practices vary. What facility A does for their auditing process may be completely different from facility B. The main goal is just that we are doing it. We're auditing what our staff are doing. Facilities can consider implementing more than one approach to performance monitoring. It's not that this is the way it has to be done and this is the way it's always going to be done. Want to make sure that we're visually inspecting the cleanliness of a room after cleaning and disinfection has been performed. This is another way of just a visual audit. And then visual assessment alone is not sufficient to ensure that all surfaces have been properly cleaned and disinfected. Just because a surface appears clean does not mean that it was disinfected. And again, this is another great resource for the fluorescent marker to be able to utilize those areas that you may not necessarily think about all the time, and a great educational resource for the staff. Auditing resources. If you're having trouble or you're new to your role, where do I even begin on my auditing? Here's some great resources that can begin to point you in the right direction for topics such as hand hygiene, environmental cleaning, the use of PPE, and then the point of care blood testing with glucometers and finger stick blood sugars and all that. So we've done all this. We've audited our staff. We've got all this data. What are we going to do with it now? Well, we got to provide performance feedback. Again, like I said just a few moments ago, we don't want to gather all this information, file it away, and then we're never going to use it again. Let your staff know. Let those individuals know this is what we've noticed. That feedback helps to increase the motivation and engagement with resulting improvements. If I know that I may not have got that call light cleaned completely on the next one, I'm going to do better. Or maybe when I was doing my hand washing, The IP showed me that I didn't necessarily get my fingernail beds really good when I was doing that. Then there's a performance improvement that I can do on the next time. Results of performance monitoring should be documented and then shared to reinforce adherence to the recommended practices. You want to provide feedback to the staff on their compliance with IPC practice and establish goals for improvement. The big takeaway is prevention is key. Infection prevention and control is an important strategy intended to prevent and reduce the spread of healthcare-associated infections. Again, we want to make sure that you have the necessary tools to be able to document that. And like Shoshana said, a visual is always great, to have a visual to be able to show staff members, this is an area that you may have missed. This is an area that you may want to pay special attention to.
So just so everyone on the call is aware, through the Alabama Regional Center for Infection Prevention and Control, we have been able to purchase one glow germ kit for hospitals, nursing homes, assisted living facilities, and specialty care assisted living facilities in Alabama. We're working with our partners, the ALAHA, the Alabama Hospital Association, the Alabama Nursing Home Association, and the Assisted Living Association of Alabama to distribute those. So hopefully hospitals and nursing homes, that distribution will start soon if it hasn't already. For assisted living facilities and specialty care assisted living facilities, that should start somewhere in the spring 2024. We're still waiting to get some additional stock from our manufacturer. If you are a nursing home, assisted living care facility, specialty care assisted living facility, and you want additional training or resources on glow germ or how to use the fluorescent agents that you use at your facility, please feel free to contact the strike team. You can see the contact information for all of the IPs listed on the screen, but you can also just email ltcstriketeam@uab.edu and we'll connect you to the appropriate team member for your area. So just wanted to make sure that everyone is aware of that resource as well. That's about 50 minutes. So thank you guys for attending and please tune in next time. Thank you.